The home care nurse is visiting a prenatal client who has a history of heart disease. The nurse provides instruction to the client regarding home care measures to promote a healthy pregnancy and instruct the clients to option 1. Restrict the visitors who may have an active infection. Option 2. Avoid becoming concerned about placing stress on the heart. Option 3. Increase daily calories to ensure weight gain. Option 4. Sleep in supine position at night. And the answer is option 1. Restrict visitor who may have an active infection. The rationale is the client should avoid exposure to infection and not allow the individual with active infection to visit. And the stress causes increased heart workload and it is not helpful. Too much weight gain causes an increased body requirement and increased stress on the heart. The client should rest on the left side to promote blood return. A nurse in the gynecological clinic is reviewing the record of pregnant women after first prenatal visit. The nurse notes that the physician has documented that the woman has a platypelloid pelvis. Based on the documentation, the nurse planned care knowing this type of pelvis is option 1. It's a normal female pelvis. Option 2 has a flat shape. Option 3 has an oval shape. Option 4 has a heart shape. The answer is option 2 has a flat shape. The rationales are a platypelloid pelvis has a flat shape. A gynecoid pelvis is a normal female pelvis. An anthropoid pelvis has an oval shape. An android pelvis has a heart shape. A maternity nurse is preparing to care for a pregnant client in a labor who will be delivering twins. The nurse monitored the fetal heart rate by placing external fetal monitor over the fetus that the most anterior to the mother abdomen. Option 2 over the fetus that is most posterior to the mother's abdomen. Option 3 so that each fetal heart rate is monitored separately. Option 4 so that one fetus is monitored for a 15 minutes per period followed by a 15 minutes fetal monitoring period for a second fetus. And the answer is option 3 so that each fetal heart rate is monitored separately. The rationales are in a client with multifetal pregnancy, each fetal heart rate is monitored separately. Option 1, 2 and 4 are incorrect because these actions would provide information regarding the status of only one fetus at one time. A nurse in a delivery room is assisting with the delivery of the newborn infant. After the delivery of the newborn, the nurse assists in delivering the placenta. Which observation would indicate that the placenta has separated from the uterine wall and is ready for delivery? Option 1. The umbilical cord shortness in length and changes in color. A soft and boggy uterus. Option 3. Maternal complaints of severe uterine cramping. Option 4. Changes in the shape of the uterus. The correct answer is option 4. Changes in the shape of the uterus. The rationale are the signs of placental separation including lengthening of the umbilical cord, a sudden gush of dark blood from the introitus, a firmly contracted uterus and the uterus changing from the discoid to a globular shape. The client may experience vaginal fullness but not a severe uterine cramping. A prenatal client has diagnosed with a vaginal infection from an organism Candida albicans. Which findings would the nurse expect to the note on assessment of the client? Option 1. Absence of any signs and symptoms. Option 2. Pain, itching and vaginal discharge. Option 3. Proteinuria, hematuria, edema and hypertension. Option 4. Costovertebral angle pain. And the answer is option 2, to assess pain, itching and vaginal discharge. The rational or clinical manifestation of Candida infection include pain, itching and a thick white vaginal discharge. Option 3 and 4, proteinuria, hematuria, edema, hypertension and costovertebral angle pains are the clinical manifestation associated with urinary tract infections.